Today we are going to talk about a condition that millions of people, especially here in India, experience every single day. It's that burning, gnawing ache in the upper abdomen, often dismissed as just acidity or gas. We are talking about gastritis. Gastritis is the most common disease found in India, or we can take it as a symptom due to unhealthy diet, unhealthy food. Food is the major cause of gastritis. Okay, and not able to digest it. Okay, digestion power also influence gastritis. Okay, but what it is? Okay, to understand gastritis, think of your stomach lining as a fortress wall designed to contain powerful stomach acid. Gastritis is what happens when that wall becomes inflamed, damaged, and breached. In this video, we will break down the causes of this inflammation from a notorious bacterium to common painkillers. Okay, explore the symptoms and diagnosis and cover the complete management plan from powerful acid blocking medicines to the crucial dietary changes you need to make. Okay, so we will begin first with what and why. What is gastritis and why it happens? Your stomach performs a remarkable balancing act every day. It 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 produces acid, it produces base so as to maintain the physiology. Okay, it produces incredibly strong acid with a pH between 1.5 to 3.5 to digest food and kill germs. At the same time, it protects itself from the acid, producing thick, rich layer of mucus. When the mucus secretion reduces, gastritis takes place because the acid which is produced by the body, it simply ruptures the lining. Okay, if mucus production decreases. Now, gastritis occurs when this protective mucus barrier is weakened or damaged. This allows the digestive acid to get through and attack the sensitive stomach lining, causing inflammation, irritation, and sometimes erosion. Okay, we can classify gastritis into two main types: acute gastritis, chronic gastritis. This comes on suddenly and is usually short-lived. What? Now, acute gastritis comes sudden and is usually short-lived. It's often caused by a direct potent irritant like drinking too much alcohol. Drinking too much alcohol is the major cause of gastritis. Taking a high dose of certain painkillers, NSAIDs, okay, or experiencing severe physical stress like after a major surgery. This is not a prime concern. Okay, major surgery is not our prime concern. Our prime concern is NSAIDs. Okay, potent irritants like alcohol, painkillers, and other foods like processed food, oily foods. You must not use this because digestion digestion takes time. Okay, to excrete the substance present in your body and to absorb the nutrients and vitamins from that food. So digestion is the major cause. Okay, if digestion rate increases in your body, then simply it will cause gastritis. So eat healthy vegetables to increase your digestion. Now we'll talk about the chronic gastritis. This is a long term simmering inflammation. These symptoms might be less severe than an acute attack, but they are persistent. Chronic gastritis is more concerning because over many years it can lead to complications like peptic ulcer. Chronic gastritis can lead to peptic ulcer. Okay, stomach lining atrophy, it can destroy stomach lining atrophy and can increase risk of stomach cancer. It can lead to stomach cancer, guys. It is not a small symptom or not a small disease to neglect. It is also a major issue to look. Now we will focus on the etiology. Okay, why and how? So that so what are the primary culprits that break down this fortress wall, means reducing mucus level? Helicobacter pylori. Helicobacter pylori infection. This is the number one cause of chronic gastritis worldwide and is extremely common in our part of the world. Helicobacter pylori is a resilient spiral-shaped bacterium that has cleverly adapted to survive in the harsh, acidic environment of the stomach. It burrows into the mucus layer, weakening the barriers and triggering a constant inflammatory response from the body. See, Helicobacter pylori simply hides in mucus, eating mucus as its source of food and reducing mucus level. Then it damages the lining of the stomach, resulting gastritis. Okay. NSAIDs use, non-steroidal anti-inflammatory drugs. This is the other main cause. Especially of acute gastritis. We are talking about very common painkillers like ibuprofen, diclofenac, naproxen, and even daily aspirin or paracetamol also. The daily these painkillers you are eating, these are all harmful. It can lead to cancer. So stop using or reduce using. If you are having pain or other things, you can simply go to natural remedies. Don't overuse these products to get faster relief. Okay. These drugs works by blocking enzymes like COX-1 and COX-2. While this reduces pain and inflammation in the body, the COX-1 enzyme is also responsible for producing prostaglandin chemicals that are vital for maintaining the stomach's protective mucus barrier. If you will directly block prostaglandins, which is most important for producing the protective mucus layer or maintaining the protective mucus barrier, then what will happen? It will lead to gastritis. So, limit using NSAIDs, painkillers or alcohol. Now, the COX enzyme, while reducing pain and inflammation, the COX enzyme is responsible for prostaglandin chemicals that are vital for maintaining the stomach's protective mucus barrier. Okay, blocking them leaves stomach lining vulnerable to acid attack. Second is excessive alcohol consumption. Alcohol consumption is way more vulnerable than you think. Way more destroying. It has way more destroying capacity. Okay. Alcohol is a direct irritant that can erode the stomach lining and increase stomach acid production. Okay. Next is severe physical stress. In cases of critical illness, major trauma or extensive burns, the body diverts blood flow away from the stomach to vital organs. Okay. This reduces the stomach's ability to protect and repair itself, a condition known as stress-related mucosal disease. Severe physical stress complete. Now we will go to autoimmune gastritis. This is a less common form where the body's own immune system mistakenly attacks the cells of the stomach lining. Simply dead end. Symptoms and diagnosis. Okay. How you can identify that you are having gastritis issue. Symptoms can vary, but the most shown symptoms or most common symptoms we have put here. First is a gnawing, burning pain or ache known as dyspepsia in the upper abdomen. Okay. Next is nausea and sometimes vomiting. A feeling of being overly full or bloated, especially after eating. Loss of appetite means you will reduce hungerness, means after eating a small amount you will feel like you are full. Okay. In severe cases where there is bleeding, you might see black tarry stools. Okay. If black tarry stool is if you encounter black tarry stool, means your lining of the stomach is 70 to 80% damaged. Okay, it is a medical emergency. Okay, so to diagnose gastritis, a doctor will start with your medical history and then may order specific test. First, he will test for H. pylori test. This can be done non-invasively through a urea breath test, where you drink a special liquid and breathe into a bag for a stool antigen test. Okay. Next is upper endoscopy or gastroscopy. Okay. This is the definitive test. A doctor passes a thin flexible tube with a camera on the end down your throat, directly visualizing the stomach lining. directly we can say it is endoscopy, where camera is inserted into a body to detect the lining, to detect how much quantity, to detect the defectiveness, to detect the impact, to detect level of deformity. Okay, they can see the extent of the inflammation and take a small tissue sample or biopsy to test H. pylori and check for any cellular changes. Okay, main mudda, we will now move to pharmacological management. The goals of medical treatment are to reduce stomach acid, which gives the lining a chance to heal, and to treat the underlying causes. First is acid controlling medicines like antacids, example Gelusil or Dizine. These are simple chemical bases that work by neutralizing the acid already present in your stomach. They provide very fast but temporary relief. They are good for occasional symptoms but don't heal the underlying inflammation. Okay, next is H2 receptor blockers, which is famotidine or ranitidine. These are the things which are H2 blockers. Okay, these drugs reduce acid production. They work by blocking the action of histamine, means they directly block histamine, which releases the acid on the stomach's acid producing cells, parietal cells, called parietal cells. Parietal cells release acids. They are blocked by H2 receptors. They are slower to act than antacid but provide longer relief. These are used for 24-hour use. Okay, these drugs are given for 24 hours, so so you can say that these acts longer times. These are present in body for longer relief. Okay, now we will move to proton pump inhibitors, PPIs, omeprazole, pantoprazole, rabeprazole. Okay, these are the most powerful acid reducing medications. They work by directly blocking the final step in acid secretion, a structure called the proton pump, in the parietal cells. By shutting down these pumps, they can reduce acid production by over 90%, providing the ideal environment for the stomach lining to heal. Okay. Next is eradicating H. pylori. If H. pylori is the cause, it must be eradicated, means it must be thrown out of your body. This requires a course of combination therapy, typically for 10 to 14 days. Triple therapy is the standard first line treatment. It consists of PPI plus two antibiotics. Antibiotic is to kill H. pylori, and the other drugs are to maintain the acid. A common combination is omeprazole plus clarithromycin plus amoxicillin. Okay, it is absolutely crucial to complete the entire course of antibiotics, means you have to be obedient with your medication adherence even if you start feeling better. Means if you are told to take it for 15 days, then you must take for 15 days rather stopping in 7 days after feeling better. Means if you are feeling better, it doesn't mean it has been cured. So complete your full course. Now we will move to non-pharmacological care. Medications can heal the lining, but lifestyle changes are what keep gastritis from coming back. Means your linings are healed, but if you do not maintain your lifestyle, if you do not maintain your food intake, if you do not maintain what you are eating and what you are not, then you will probably encounter this disease again. Okay, so first major thing is dietary management. This is the key. You need to identify and avoid your personal triggers. Common culprits include very spicy food, oily, fatty and fried foods, caffeine in coffee and colas, alcohol is the major cause. Please do not use alcohol. Next is carbonated beverages, means highly carbonated substances. Highly acidic foods like tomatoes and citrus fruits for some people, means you have to reduce use of lemon, oranges, okay, which are citrus in nature, which have vitamin C and which are citrus in nature. You have to reduce its use because it simply increases the amount of acid present in your body, because these are acidic in nature. Eating habits: eat smaller, more frequent meals instead of 3 large ones. Means you can eat 4 to 5 times a day, okay, rather eating 3 full times. Okay, and morning eating is must. You must eat in the morning. Okay, if you do not eat in the morning, the acid simply accumulates in your body and ruptures the lining of the stomach. So morning food intake is must. Okay, now it is eat smaller, more frequent meals instead of three large ones. This prevents the stomach from becoming overstretched and producing a surge of acid. And avoid eating within 2 to 3 hours of bedtime. Means eat before 3 hours of your sleep. Eat at 7 to 8 o'clock, then move to sleep at 11 o'clock if you are having busy schedule. If not, then eat at 5 to between 5 to 6 o'clock in the evening. It is a best method used by the Chinese, where they complete their dinner at 5 to 6 p.m., then go for sleep at 9 p.m. and wake up at 4 a.m. Sorry, 4 a.m. Then they have a king like food, means they have whole food with nutrients, with vitamins, with proteins, with carbs, everything, a bunch of food. Means you have to eat full belly food, means you have to fill your belly. Okay, lifestyle changes. If you smoke, stop it. Smoking, stop it, because it can impair the healing of the stomach lining. Means if you are taking the medications, then also you are continuing your smoking habit and drinking habit, how you will cure it? Okay, it's also a challenge for the physicians who have these types of habit, because they get defamed that this doctor is not good, or blah 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 things. Okay, so first look at yourself, what you are doing, how you are maintaining the things, then you can blame to others. Okay, also find healthy ways to manage stress like yoga, meditation, or regular exercise, as stress can worsen your symptoms. See, as I told you in every section of my video, that mental condition is the most important parameter for managing a disease. Means if you are mentally healthy, mentally strong, you can control any disease or you can prevent any disease. Brain plays vital role, a very vital role. Okay, now we will go for Ayurvedic perspective. Okay, in Ayurveda, this condition is often called amla pitta, means increasing pith, acid, caused by an aggravation of the pitta dose. Again, these traditional approaches can be supportive for symptom management, but should not replace medical treatment for serious issues like an H. pylori infection. Means you have to take the antibiotics to kill H. pylori infection. Okay, to better your digestion, to better your food intake, and to manage your acid, you can use amla, which is Indian gooseberry, and these are mostly found in Rajasthan areas. So known for its cooling properties, it can help balance stomach acid. Yasti Madhu, licorice root. See, licorice root I will not suggest, because it spikes glucose level in the body. So the persons with diabetes must avoid licorice root. What it is written here, it is that this is a fantastic herb for the gut. It's known to soothe muscle linings and has anti-inflammatory properties. Rather than anti-inflammatory properties, licorice root also have shown benefits for skin elasticity, okay, and skin texture. Okay, licorice roots have enormous benefits, but a disadvantage that it increases blood sugar level. Okay, so it is not recommended for diabetic people. Jeera is the best thing. Jeera is the best thing you can do for bloating and indigestion. Simply put some amount of jeera, likely to be 2 to 3 grams, in water and rest it for whole night. In the morning, drink the water and chew the jeera and eat it simply. We will not move the summary and conclusion. And like crucial disclaimer, I will tell you, the content in this video is for educational purpose only and is not for a substitute or professional medical advice. So always consult your doctor or qualified healthcare provider for any health concern. Thank you for watching. Blah 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 things are written here. Do not waste your time. Move to my next video.